Right now, somewhere in America, a man in his 70s is waking up the way he does every single morning. His mouth feels dry, thick, almost like cotton. He runs his tongue across the roof of his mouth and it sticks. He doesn't think anything of it. He reaches for the glass of water on his nightstand, takes a sip, and starts his day. He has done this for years. And what he doesn't know, what nobody has ever told him, is that this small, quiet, almost invisible symptom may be the first warning sign that his brain is slowly being affected. Not by age, not by bad luck, but by something sitting in his own medicine cabinet. Something his doctor handed him. Something he takes every single day, believing it is helping him. I need you to hear me very clearly today, because what I am about to share with you is something that took me years of clinical practice to fully understand, and something that almost nobody is talking about. Millions of adults over the age of 60 wake up with a dry mouth every single morning, and they have been quietly taught to believe it is just a normal part of getting older. It is not. In a very large number of cases, that dryness is not about thirst. It is not about the weather. And it is not about how much water you drank the night before. It is your body raising its hand. It is your body trying to tell you that something is interfering with the very same signals your brain depends on to stay sharp, to hold memories, and to think clearly. The most common cause of this is something that is considered completely safe, something millions of older adults take. Some of these medications require a prescription. But some of them, and I want you to really sit with this, some of them are sold right over the counter, no prescription needed, sitting on the shelf at every pharmacy in the country. And at least one of the 9 I am going to walk you through today has been directly linked in major studies to accelerated cognitive decline. The frightening truth is that most doctors never connect these dots. They treat the dry mouth as nothing. They treat the memory slips as just aging. And the years go by while the real cause is never named. So stay with me all the way to the end, because the medication I have placed at number 1 is so common and so trusted that you may have taken it last night without a second thought. Everything I create here is built specifically for adults over 60 who want real answers, not vague advice. Subscribing is free, and it makes sure this kind of information actually reaches you. Now, let's continue. I am not going to spend your time with a long introduction, because what matters is not my background, it is what I have seen. And what I have seen again and again, in exam room after exam room, is a pattern so consistent that it changed the way I practice medicine. I have sat across from families who came to me terrified, telling me their mother or their father was slipping, forgetting names, repeating questions, losing the thread of a conversation, getting confused in the late afternoon. And almost every single time, the family believed they were watching the early stages of dementia take hold. They had already begun grieving. And what broke my heart was how often, not always, but far more often than people realized, the real story was different. The real story started years earlier, with a dry mouth that nobody questioned, and a medication list that nobody ever reviewed as a whole. I remember one woman in particular who sat in my office with her adult daughter, both of them holding back tears, convinced the worst was coming. And the regret in that room was the hardest part. Not the fear, the regret. The sense of why did nobody tell us sooner? Because here is the truth that I carry with me every day. By the time the brain symptoms become obvious, a great deal of quiet damage has often already been done. The body starts whispering long before the brain starts struggling. And the dry mouth is one of those whispers. So let me explain why. You do not need to memorize that word. You just need to understand what it does. Acetylcholine is one of the most important communication chemicals you have. It is deeply involved in memory. It is deeply involved in learning. It is involved in focus, in clear thinking. And yes, it is the signal that tells your salivary glands to produce saliva and keep your mouth moist. A whole category of common medications works in part by blocking acetylcholine. Doctors call these medications anticholinergic. And again, you do not need the technical word. You just need the picture. Imagine someone quietly turning down the volume on that messenger. When you turn down acetylcholine, 2 things happen at the same time. First, your salivary glands get a weaker signal, so they produce less saliva, and your mouth goes dry, especially overnight, when nothing else is stimulating saliva flow. And second, that very same messenger that is being turned down is one your brain relies on for memory and clear thinking. Do you see the connection now? The dry mouth and the brain fog are not two separate problems. They can be two faces of the exact same thing. The dryness in your mouth can be the visible, touchable, physical proof of a process that is also happening somewhere you cannot see or feel inside your brain. And most importantly, adults over 60 often take several medications at once, and the effect of these drug stacks. One alone might be mild, but 3 or 4 together can create what we call a heavy anticholinergic burden. That is the real danger. Not always one villain, but a quiet pileup that no single doctor ever sees all at once, because one doctor prescribed the sleep aid, another handled the bladder, another the mood, another the allergies, and nobody ever laid the whole list on the table together. So let's lay it on the table now. 9 of them. And they get more serious as we go. The over-the-counter allergy and cold medications, the older antihistamines. Millions of older adults reach for these without a second thought. For seasonal allergies, for a runny nose, for sinus pressure. And here is the cruel twist. The very same ones are often marketed as nighttime or PM formulas because they make you drowsy, so people use them to fall asleep too. But these older antihistamines are strongly anticholinergic. They turn that messenger's volume way down. The ignored symptom is waking up with a parched mouth and a thick tongue, and people blame the dry air or the heating. The deeper concern is that regular, long-term use of these has shown up repeatedly in research connected to cognitive decline in older adults. I once had a patient who took one nearly every night for years, simply to sleep, and described his mornings as feeling like his head was wrapped in a towel. The practical step here is simple. Talk to your pharmacist about whether a newer, non-drowsy allergy option would work for you instead, because newer generations of allergy medication are generally far gentler on this messenger system. I want you to really hear this one, because sleep is something this age group struggles with constantly, and the solutions can quietly cost you. Many popular sleep aids, including ones you can buy with no prescription at all, rely on that same drowsy, anticholinergic ingredient I just described. People take them night after night, sometimes for years, chasing rest. The dry mouth in the morning gets dismissed. But the concern is that you may be trading a few hours of sleep tonight for a slow erosion of the very brain function you're trying to protect. What happened to one patient of mine stayed with me. Her family had started finishing her sentences for her, certain her memory was failing, and a great deal of it improved once we found her a gentler path to sleep. If you take something every night to sleep, please do not stop it on your own, but do write it down and ask your doctor directly whether it carries this burden. But many of the classic bladder medications work specifically by blocking acetylcholine, because that messenger also controls bladder muscle signals. So they are, by design, strongly anticholinergic. The dry mouth here is often severe. Patients describe it as the worst dryness of any drug they take, and that is your clue to how powerfully the drug is acting on that whole system, brain included. The ignored part is that people accept the dry mouth as the price of bladder control and never ask if there is a newer option. There often is. Ask whether a more modern bladder medication, one that works through a different pathway entirely, might be right for you. Some antispasmodic drugs used for stomach and gut discomfort are anticholinergic by nature. That is literally how they calm the spasms. The dryness, again, is the visible signal. The point is not to frighten you off treating real digestive pain. The point is awareness. This is another quiet contributor to the pile. Many older adults deal with balance issues and dizziness, and some of the older medications used to settle that are, you guessed it, anticholinergic. One patient told me her dizziness was treated, but she started feeling foggy and far away, and that fogginess was the part nobody had warned her about. If anything so far has made you think of a bottle in your own home, if you are sitting there doing the math on your own medicine cabinet, do me a favor and type the word memory in the comments right now. I read these, and it genuinely helps me understand how many of you this is touching. And if this video has been valuable so far, a quick tap on the like button helps it reach another person over 60 who needs to hear it. Alright, let's keep going, because number 4 is where this gets personal for a lot of families. The dry mouth comes alongside a kind of dullness people often blame on poor sleep or just getting older. I had a patient, a former carpenter, sharp as a tack his whole life, whose family was quietly convinced he was developing dementia, and a major piece of it lifted after we re-examined a muscle relaxant he had been on, almost forgotten, for years. Depression in older adults is real, it is serious, and treating it saves lives. I am not telling anyone to fear their treatment. What I am telling you is that the older class of antidepressants, the ones that have been around for decades, tends to be strongly anticholinergic, while many newer options are far gentler on this messenger system. The dry mouth from these can be intense, and intense dryness is your signal that the drug is acting powerfully on the whole acetylcholine system. If you take an antidepressant and live with a constantly dry mouth, that is not a reason to stop. It is a reason to have an honest conversation about whether a more modern option could protect your mood and your memory at the same time. Number 2. Antipsychotic medications, which are sometimes prescribed to older adults for agitation, sleep, mood, or behavioral symptoms, sometimes in settings like care facilities. Many of these carry a heavy anticholinergic load, and the population taking them is often already the most vulnerable. The dry mouth is profound. The concern is profound. If you or someone you love is on one of these, this is exactly the kind of medication that deserves a careful, regular review with the prescribing doctor. Never stopped abruptly, but never left unquestioned either. It is the stack. It is the 72-year-old who takes an over-the-counter allergy pill, plus a nightly sleep aid, plus a bladder medication, plus something for muscle pain, none of it reviewed together, each one prescribed or bought in isolation. Individually, each might be considered mild. Together, they create a heavy anticholinergic burden, and large studies have linked exactly this kind of cumulative load to meaningfully higher rates of cognitive decline and dementia. This is number 1 because it is hiding in plain sight, in millions of homes, and the only person who can see the whole picture is the person willing to lay every single bottle on the table at once. That person can be you. I had a patient, a man in his mid-70s, who told me he woke up every morning feeling like he had swallowed chalk. His family had quietly started treating him as if he were already gone. We did one thing. We sat down and reviewed every medication together, as one list. We found 2 drugs with overlapping effects, both with safer, more modern alternatives. We made the changes carefully, with his doctors. Within weeks, the dryness eased. And within a couple of months, he looked at me and said his thinking felt sharper than it had in years. That is the part I need you to hold on to. The dry mouth was the warning light on the dashboard, and a warning light means there is still time to act. So here is what I am asking you to do, and it is gentle and it is safe. Do not stop a single medication on your own. That can be dangerous. Instead, this week, write down every medication and every over-the-counter product you take. Everyone. Bring that full list to your doctor or your pharmacist, lay it on the table, and ask one direct question. Do any of these have anticholinergic effects? And is there a safer alternative for someone my age? That single conversation has changed lives in my practice. It could change yours. And tell me in the comments, how many medications do you take each day? And has anyone ever talked to you about this before? I read your stories, and they matter. Now, I want you to keep going, because the video showing up on your screen right now connects directly to everything we just talked about. It goes deeper into the early warning signs your body sends before your memory ever changes. Go watch that one next. Your body may be trying to warn you, gently and quietly, long before your memory ever starts to fade, and you still have time to listen. Take good care of yourself. I'll see you in the next one.